substance abuse treatment center in the Caribbean. 60% of our clientele are women with HIV.
Since 2004, when the government of Trinidad began providing antiretrovirals, none of Serenity Place's HIV-positive clients have died of AIDS.
So that when they come into a treatment center like ours, where we support and provide the facilities for them to get their medication, it makes it a lot easier for them to access it.
More facilities are needed specifically designed to meet the needs of HIV-positive patients, substance users, and women in particular.
Presently, we don't have a specific place for HIV-positive people. They need a home of their own. When some of them get really sick and they cannot be taken care of in the treatment center, they need to have that place provided for them. So just medication is not enough.
The facilities that are around seem to have been established by men for men. And I think what we need now is some female thinking in the establishment of these facilities. For example, there is no facility in Jamaica. There has not been, there isn't any now, that looked at the fact that women who are drug users also have children, and think that you could establish a facility where the drug using female is allowed to bring one or two of her children, with her. That has not been the thinking. And I think that's the kind of thinking we need now, so that the special needs of women are thought of when a facility is being established.
It is very important to have women-only program. Some of the women have other issues, like children, some of them because of their HIV status, some of them are because of other STIs, and other kinds of family problems and domestic problems and stuff like that. They can't sit in a group and talk with men in it, and they're not comfortable and that kind of thing. A lot of them have a lot of domestic violence.
Trinidad's Oasis Center provides a place to shower and get clean clothes for substance users and homeless persons. But not enough of these facilities exist across the region. Before founding Patricia House, GOP ran a drop-in center that provided food, bathroom facilities, counseling, and other basic services for substance users and the homeless.
We had clients living on the streets who were deportees, who wanted to make contact or maintain contact with relatives abroad, but didn't have anywhere to use as an address or even to make a phone call from, or where they could sit and expect a phone call. And so they used the drop-in center for services like these. Clients would receive their letters there from abroad. They sat there and waited for telephone calls, and this kind of service we provided. It was like a point of stability for many of our clients.
In Jamaica, the Ministry of Health and the National Council on Drug Abuse are joining forces to introduce a mobile clinic to target homeless persons and substance users.
We are going to get specialized staff to work with this population. We're going to employ 3 staff members specifically for this program. We're going to identify where the homeless population congregates, do some testing, random testing. Those who are HIV positive and substance abusers will be identified. We'll arrange treatment options for them, especially through the government clinics. We'll arrange treatment for them where they may be injured or wounded, feeding programs, opportunities for them to get clothing and other help where possible, and generally increase their welfare, their quality of life.
There is no question about the need for street-based intervention. One of the things is that you have a population that is either not going to go into residential service, or they're simply not ready to go in there. My thing is that because they don't want to go into a residential facility, or because they are not ready, does that mean they should not be provided with services? And my answer to that is they should be provided with services.
Our outreach workers, while on the streets, if there is a homeless person who is interested in finding out what is his HIV status, or just knowing his status and wanting to access a clinic, they can approach our street, we call him the field officer. The field officer is out on the street with our ambulance so that the person can be transferred directly to a clinic to access the whatever, the testing or his follow-up medication and that kind of thing.
In St. Lucia, Dr. Marcus Day adopts an even more proactive approach, training his team of volunteers to package HIV medications for patients who may find the number and the varied dosing patterns too confusing.
These are the antibiotics. This is an ARV. He basically takes this twice a day. This is a tedious and long process. See, they have a law in St. Lucia. The pharmacists push through a law that says only pharmacists can dispense medication. So what we say is we don't dispense the medication. We just go to the pharmacy and get the prescriptions filled, and then we just package the medication into doses to make it easy for the patient to take his medication.
Simple solutions that are helping to make access real. As we move towards 2010 and the goal of universal access, what we need is an integrated approach to HIV and AIDS treatment. Integrated in addressing the dual pandemics of HIV and crack use. Integrated in terms of a holistic approach to patients that meets their medical, physical, and psychological needs. Integrated in bringing together a network of government, private sector, civil society, and community leaders who can respond effectively.
So when one comes into our program, we don't really look at the crack using. That's the tip of the iceberg, so to speak, you know. We look at the whole person so that HIV clinic and support and treatment is critical because we are concerned about the physical, mental, and spiritual well-being of our clients all the time.
My solution, one of the solution to this is that provide us with the medication, provide us with the food. We will make it our point of duty to go out there to them. We have a list. We'll go out there to them, we'll make sure that them eat, and once them eat and then digest them food, we'll make sure that them take them medication. And that will help us to know that we are going the extra mile. We are willing to make that difference, help us to make it happen for those who need it the most.
Until everyone has access to treatment, everyone is affected.